JACC Interventions, and we're talking about survival in high-risk patients after transcatheter mitral valve repair. And I'm with Dr. Martin Swaans, who is from Antonius Hospital, Utrecht, the Netherlands. Actually, you're near the Netherlands. Where are you from?
Yeah, we're from the Netherlands, but Nieuwegein. It's not completely Utrecht.
There we go.
We're close to Utrecht.
That's a great one. I wasn't going to pronounce that one. And this is really the first study to compare transcatheter MV repair with surgical and conservative treatment in high-risk patients with symptomatic MR, right?
Yeah, that's it.
Okay, why'd you do this study?
I think it's important that MR is a clinical important entity, and more than 30% of the native valve diseases are MR related, and patients with an MR, symptomatic MR, have a poor annual prognosis. They have a lot of complaints, heart failure complaints, and have an annual mortality, especially with when it's accompanied by heart failure, with annual mortality rates up to 50% in 5 years. So it's really a disease, a big problem, and surgical treatment can really improve the outcomes in these kind of patients, but as we've seen from the EuroHeart survey, is that more than 50% of these patients are denied for surgical treatment. So they have a class 1 recommendation, but still they are denied for this treatment, and that's due to comorbidities, increasing age, and I think the transcatheter mitral valve repair with the mitral system might be an alternative to decrease the risk of these procedures in these kind of patients.
So in your paper in JACC Interventions, how many people were you looking at, et cetera?
We included 139 patients who had a mitral clip, so that's from the starting of the mitral clip, the consecutive patients. So we started in January 2009 till April 2013, then when I started analyzing the results. And what we did, so we had 139 patients with a mitral clip, and we retrospectively look at the 2 years prior to the start of the mitral clip therapy, and we look at all the heart team discussions, all patients that were referred, and we came to more than 300 patients that had mitral valve surgery with or without CABG, and we looked at specific characteristics like a Euroscore above 20, high risk, frailty, high risk criteria, and selected the patients that were high risk or were denied for surgical treatment. So, and what we found is we had 53 patients that were high risk surgery patients, and 59 patients that were treated conservatively. And there were some imbalances between the groups. If you look, the mitral valve group was more functional MR, higher logistic Euroscore, left ventricle ejection fraction was lower, and high percentage of functional MR like in the conservative group. And the logistic Euroscore was lower in the mitral valve surgery group, and a better ejection fraction was seen. So there was a little bit of a difference between those groups. But what we did, we compared survival in these patients. So if we look at the survival after 1 year, we saw that around 85% of the patients with mitral clip and mitral valve surgery, high-risk surgery, was still alive, and that was compared to 64% in the conservative group. And so a big difference in survival in these kind of patients. And what we saw, the trend continues after the 2nd and 3rd year. So there was a huge benefit over treatment above conservative treatment. So
despite the fact that these people had high Euro scores and were actually at higher risk, they did really well.
Yeah, there's a lot of discussion in the surgical group too. If treatment of these patients, we know it increases severe mitral valve regurgitations in patients with a functional MR, increases the mortality, but unfortunately until now surgery hasn't really proven its benefit in these kind of patients. So maybe with a less invasive procedure we can also do this. So that was the goal of this study, and what we did is we used propensity matching to equal the balances in the groups, and what we saw is that there is a hazard ratio of 0.4 benefit for patients having the mitral clip against conservative treatment, and the same pretty much 0.5 was seen for surgical patients. So a huge benefit, mortality benefits when these patients were treated. And when we compared mitral valve surgery and mitral valve clipping, there was no difference in these groups. So
this was a fairly small trial, but do you think there's a take-home message, some clinical application here that people might learn a lesson from?
Yeah, of course, the study has limitations, but all the studies also in surgical groups have their limitations. Also yes. Retrospective and smaller groups, one single center, so these limitations also occur for our center. But I think even though we are small and the limitations there, it seems like there is an improvement in this therapy with if you clip these patients, and we already have seen that we can improve their functional capacity, we can improve their quality of life, we can improve their 6-minute walk test. But it seems like these patients who are re-hospitalized several times also have a mortality benefit. So probably. Because of the high mortality rate, we should do something for these patients, and at least it's symptomatic, but also it seems like in this study that they can have a mortality benefit over conservative treatment.
That's really impressive,
Yeah.
given what the high-risk population you're looking at.
Absolutely, absolutely. And I think what's also interesting is that if we only look at the functional mitral valve regurgitation, because this is the most critical, the difficult group, and if we look at only the functional mitral valve regurgitation, we saw the same results actually. So, and this is a study that's going to perform, or is under enrollment now. It's the COAPT and the Reshape in Europe and the USA. So, but the results will come after a few years. So I think this now has the potential at least fill some gaps in our knowledge, and it seems like we should treat these patients. So.
Well, the study is JACC Interventions, so please look for Swaans et al. And for Cardiol Source World News, I'm Rick McGuire, Executive Editor.